Look at the speed of these things. So change is actually moving very, very fast. So one, understand why we need to change, and secondly, how fast things are going, and we need.
And people are scared of change. You know, that's a big block.
Yes.
Yeah.
I mean, we.
So fast that we are actually caught unaware. And suddenly you wake up one day and say, my God, so much has changed. I have not progressed, or everybody seems to have not progressed, because the change is moving so fast. And then you try to fit in your old style into this new environment. It just doesn't work.
That is what I think we're trying to do, we as a group. How do we actually go about it? When I have my discussions with Peter, we really are talking about changing the whole system. And you said that, system, process, structure, that is also part of our work if we are going to be involved in this. So it's a whole system that we're trying to change. Whereas, and of course that is in itself is a big elephant. We ourselves will find ourselves getting indigestion. So the session today is about how we go about doing it, what are the things, what are the first steps, and what we want to do after we leave from here.
Were already being educated, then there was another thing they were looking for, which is experience. Do you have experience? Because you and Vimala could have the same education. Who am I going to take now? Because everybody seems to be educated. So I need to see which one of you have skills. And skills became an issue. And then what happened? Well, you also got 5 years experience. You also got 5 years experience. Bob also got 5 years experience. You all are equally qualified. What do I do now? Oh, then I have to see who amongst you has got the best character. Then they come into behavior. This one I can find out. I call the college, I see a certificate, I know. Skills, I can call your previous employer. And this one, how? I cannot find out about your behavior in half an hour interview, right? So this is where all the psychologists and all the psychometric tests came out. All the behavioral competency tests. You sit down and you do, and you'll find out, okay, I know what is her character, what is character.
That's so limited.
Limited. Why? Limited. Now you go to the internet, they will tell you how to answer these questions.
You can cheat. You can cheat.
There are tons of sites telling you how to answer psychometric tests. You also cheat, right? So you realize that even with all this, it is still not enough. It comes back to talent. Here you cannot cheat. If you are talented, it shows. If you don't have talent, it doesn't show. You cannot cheat talent. And this is where, when people are talented and they're doing the job because they are talented, the passion is continuously flowing. Now, this is a hard and long call, isn't it? For nurses to have education, skills, the right behavior, and yet they are totally passionate about healthcare. But if you had a candidate with all this, it's a home run. But it's not easy to get this. Okay, let's say you manage to get all that. You get good performance, but a good performance does not just depend on the individual here, because it is the individual plus organization. There must be the right fit. I've got talent, I'm really with the best behavior, I've experienced, and I'm educated. And I come and work in here, I have a doctor who tells me off on my face. So what happens? You have two bars here. This is called the can-do bar, and this is called the will-do bar. Can-do means I know the job because I have these two. I start at 6 and I'm working every day. It can only go one way, up, because I'm getting better every day, right? The will-do bar, I come to work on day 1, I start at 10. 1 week later I can be at 2, because this is affected by myself or more oftenly by the organization surrounding. If we can only address this issue, but the starting point is not just here. To get the people in the organization to understand that you people running the organization buck up. Because when you buck up, you get this.
That's right.
But you have people who are in the older generation who are holding the fort. And you have people from the younger generation coming into work. And there is a total mismatch and a gap of the two generations cannot see eye to eye. Problem starts.
That is where.
I feel it's exciting if we can get the two generations of nurses together. I mean, I think that's a very exciting thing because I really don't know how to do it. You know, and I feel it's so badly needed. And I feel it's sad that there is such a resentment for new staff coming into the profession. I feel very sad on that. And I feel very sad for the new nurses themselves. Because we all started one day.
Yes. We were in their shoes.
I think since we have a lot of nurses do not know who to complain to, where to go, and we can have all these government bodies, but they are like so humongous and so impersonal, and that there's so much of bureaucracy that you have to go through. It's like, why bother? Yes, and as of today, we are actually looking at two areas. One is the performance, improving about having responsible healthcare, and the other one is developing the individual as such. So so that when these two things take place, we definitely would have an improved situation.
How do you feel about what we started with, and what else? Help me out here.
Say what's on your mind.
Well, say what's on your mind. Yes.
I'm
really excited. One, being here, and number two, management has always been my passion, and I'm glad that this is yet going to be another avenue, more of a project-based where I could make a difference in some way, and I'm really looking forward to it.
As for me, it is my life purpose now. to bring a life difference to the life of people.
Yes.
And I've been doing this on a small scale, one-to-one basis, and in my community, my Christian community. And I'm looking forward to do something on a bigger scale, outside to the outside world. I find that this is probably the area my good Lord is asking me to go into, You ask.
I said earlier on that we were all meant to be here, and I strongly believe that. Otherwise, I wouldn't be here. I'm a bit emotional now. On my 62nd birthday, to find that the Health Foundation in Malaysia can be set up is just overwhelming.
And I hope my Facebook friends would also support me in a way that will make this such a huge success, because it's all about healthcare. It is about them too, and about their future, about their their work, and about basically about the patients that we all are. Eventually, some way or some form, we will end up in the hospital. Unfortunately, that is so true, but we should be prepared to take these kind of responsibility and do something about it. Otherwise,